As I have done in the past town halls, I'm going to try to give you the best I can of the general COVID-19 update. And I'll start really talking about the world and moving to the Bay Area and UCSF Hospital. So at least as of late morning, if you took the worldwide site, which is even a little bit ahead of CDC on their numbers, there were 963,000 people infected with COVID-19 and almost 50,000 deaths. In the United States, that total was 216,000 infections and 5,140 deaths. You're all reading about New York. Horribly, deaths in New York doubled in the last 72 hours. And you know that the stockpile has been essentially drained for especially New York City. If you move to California, it's at the moment a more positive outlook. As of the April 1 update, there was a total of 8,155 positive cases and 171 deaths in California. Some interesting statistics: of the now roughly 1,900 California COVID hospitalized patients, 774 required ICU care. So that's about 40% of all hospitalizations, reinforcing the morbidity associated with this disease. If you're interested, I've mentioned to some of you, there is a wonderful University of Washington website that is giving their best case of projected peak in each of the 50 states. And they project that the peak in California will be April 26th. And they predict that day alone, there will be 119 deaths in California. The total California deaths projected by August 4th, they project in excess of 5,000. I want to remind you something. California is a big state, and what happens in Northern California is already predicted to be earlier than Southern California, and at the moment, looking to be not quite as severe. Again, take that with a grain of salt. If you take San Francisco and specifically UCSF as of this exact moment, there are 16 patients that are hospitalized at UCSF. 9 of those 16 are in critical care. 5 required ventilators, therefore intubated. And I will remind you that this number has gone up by about 1 or 2 every day or 2. Now, so on one hand, yes, the total's the highest it's been. On the other hand, the rate of rise is absolutely nowhere what we thought it would be. But I caution you, and you can believe or disbelieve the model from University of Washington I described, but if they are right, the real peak is still 3 weeks off. I think Northern California, it's going to be a much earlier peak, again, to repeat, than will be Southern California. A few in the media things to update you on. One, I think you're aware of, there have been changes in recommendation for wearing the surgical mask. At UCSF, we have adopted that completely. Anybody, any of us that's in any clinical area must wear surgical masks. It's debatable whether or not it makes a difference in getting the disease, but it's felt that if it makes people feel better and maybe causes them to still use good social distancing, then maybe that's okay. And at the moment, there's not a shortage, at least at UCSF. And I think, you know, while the state has not pulled the trigger, Gavin Newsom is talking about similar sorts of recommendations over and above those that we've adopted at UCSF starting last Sunday. The other in the media that to point out is the director of CDC stated that 25% of people infected with coronavirus may remain asymptomatic for duration of their infection. And so this is one of the reasons coronavirus may be so contagious, is that people can spread it up to 48 hours before they actually feel the symptoms, or if they ever experience symptoms at all. And so that's very early summary, and that needs additional clarification. And the very last point would be, I'm sure you know about the recent trial with hydroxychloroquine that was reported just today, essentially, suggesting that it might be effective in reducing the time a patient has cough and fever. There was a significant reduction in time with cough and fever in patients, and this came out of China. And perhaps, albeit it was not statistically powered, perhaps reducing the likelihood of progression to more severe disease. To be even keeled about this, as you know, there has been a bit of a panic in terms of acquisitions of not only hydroxychloroquine, but chloroquine and other drugs. And we have to be very careful. I will point out that pharmacies provided for head up in the US were prescribing massive amounts of particularly hydroxychloroquine intended to create stockpiles and then create these inevitable shortages. So those are being addressed as best we can. And I think you know from our Poison Center colleagues that in fact there was a couple out of this state who acquired chloroquine phosphate, which was used for fish aquariums, and overdosed on the chloroquine phosphate. In the couple, the man died from an arrhythmia and the woman is still ill. So this reminds me the importance of evidence-based decision-making as it relates to this disease and what you should or should not do with these drugs. And so I think we have to be patient as this data becomes available to then be able to be nimble and appropriately respond. But in the meantime, to not assume that in fact, some of these drugs in fact should be used the way that some are using them. Now, flipping a little bit here and switching gears, as I said, I wanted to get a couple of school updates that were specific to a couple of things. The first of which I'm asking for a COVID-19 basic or discovery science school research update. And I've asked Dr. Andrej Sali, who's Associate Dean of Research, to provide that update. I will say before Andrej has the stage here, next week you can expect a clinical science COVID-19 research update, and that will be taken place by Fran Awika, who's Vice Chair of Research in the Department of Clinical Pharmacy. So Andrej, the floor is yours.
Thank you, Joe. So as many of you very well know, many of us have thought about our research expertise and how we could contribute to the attack on the virus. And so as a result, we actually have quite a large number, and I would say an increasingly large number, of both small and large efforts by individuals and groups in our departments at QBI, obviously at UCSF at large. And we have organized, I think, quite rapidly, although there's clearly challenges in that due to the time demands, the size of the effort, the heterogeneity of the efforts, and so on, for obvious reasons. And so what I'll do here is simply list a number of efforts that I'm currently aware of, and I'll no doubt miss many, so forgive me for that. I believe that Susie Lemmings is collecting a comprehensive list of various efforts, COVID-related efforts in the School of Pharmacy, so you could be in touch with her directly, if not through the department chairs. I would perhaps start with what I think is probably a flagship effort of sorts, and maybe even a useful model for how to organize large efforts. And that's the QBI's effort led by Nevin Krogan. It's called, as most of you probably know, the QBI Coronavirus Research Group, QCRG. There is a website, a pretty informative website. Just look for QCRG, QBI, you'll get it. And it, at the moment, includes approximately 30 research groups, many of which are from PharmChem and BTS in the School of Pharmacy, as well as, of course, the entire UCSF, Gladstones, and from elsewhere. This effort started with Nevin's experimental map of human proteins interacting with each of the viral proteins. There's a paper, it came out in bioRxives if you wish to look it up. And it now contains 11 or so, over 10 different research subgroups that are focused on different topics, each one of which typically includes several research groups, has leaders, includes students, postdocs, technicians in these labs, meets periodically, shares goals, and collaborates on the actual research. I'll quickly list their names. I think that most of you know about that, so we can go through that real quickly. There's a group on drug discovery, structural biology, bioinformatics and systems biology, modeling and mechanism, protein trafficking, virology, translation, metabolism, epigenetics and chromatin, ubiquitination, and mitochondria. There are additional efforts I'm aware of, some of which I'll list right now as well. And that is just, again, an incomplete list, I am sure. Jim Wells, for example, is producing recombinant pieces of SARS, of the virus, as well as the human host receptor. And he's working with BioHub and others at UCSF to develop viral detection and serological assays. And he's also working on a phage display screen or screens to find viral protein blockers for testing in the coming weeks elsewhere. Bill DeGrado is similarly designing proteins that bind to the spike protein. He's collaborating with others, including structural biologists, to follow up on his studies. Tejal and Shuvo, Tejal Desai and Shuvo in our department are part of the engineering consortium, including Berkeley, Stanford, as well as UCSF. And they work on various issues related to PPEs. Ranging from new N95 mask material to ventilator designs, mask decontamination, and so on. Rada Savic is working on translational pharmacology to optimize drug repurposing, and in particular, she's involved in optimizing the regimen for use of this new drug Joe mentioned, hydroxychloroquine, in collaboration with other institutions. Nadav is developing a rapid testing method for COVID. Don't know exactly what's the basis of his effort, but that's the topic. Kathy Giacomini, Nadav Achituv, Kathy Giacomini is studying the interaction of drugs in clinical trials to treat or prevent COVID-19 infections. Diana Krotz is looking at interactions between transporters and viral proteins. Sue Guo is looking at the ACE1 and antihypertensive medications relationship in view of her renin-angiotensin expertise. David is looking at effects of COVID infection in human cardiomyocytes. So as you can see, these are all examples of people using their own expertise, adapted very quickly to what may be needed or what would advance our knowledge about the COVID situation and eventually, one way or another, directly or indirectly help dealing with this problem. I also would note, lastly, that there's a lot of labs who have given supplies to the health center and BioHub as asked, and maybe there's more such supplies and you can give some more. And as the very last point, I know that I'll point out that the website of the Office for Sponsored Research at UCSF has a web page that's dedicated to 19 funding opportunities, since obviously at some point all this research will need to be funded. So you may want to go there for funding opportunities, as well as some other information about COVID-19 related, grant related aspects. You'll find it useful probably. Thank you.
Thank you, Andrej. That was a fantastic summary, and it is so encouraging to see this kind of big thinking coming out of the School of Pharmacy, always in collaboration with others, at a time that we have a lot of firefighting to do. And so it's just a fantastic thing to see such efforts come out that have been recognized nationally. So thank you again for that fantastic summary. I'd like to now shift gears, and as I mentioned earlier, I'm asking Michael Nordberg, Associate Dean, Finance and Administration, to provide his own general administration updates, but specifically talk a little bit about the direct pay provision in the stimulus bill. Michael.
Thank you, Joe. There we go. Okay. So there's various things that people should be aware of if they're not already. So in terms of telecommuting, there is some excellent advice on the COVID-19 website titled Remote Work Resources that gives some good things about how to forward your phone, how to block your cell phone, and various other things. The departments are willing to reimburse, and you would talk to your supervisor for additional supplies you may need to work at home, such as mice, keyboards, etc. We're not reimbursing for furniture, however. If somebody's job, it's not possible for them to do it remotely, there are employee volunteering or redeployment possibilities with UCSF Health, but you do have to meet certain requirements in terms of vaccinations and TB tests. That, once again, is on the COVID site. The policy, I think everybody maybe has seen that there right now has a 128-hour bank of paid administrative leave. This is actually now showing up in HPS in your balances if you check your leave balances. And there is a specific leave designation to select when you're selecting a leave. It's our COVID-19 selection that would indicate that. Now, there's certain conditions that which you would use that leave, and I advise people to talk to their supervisor about any leave that they're planning, whether it meets the criteria. There's also right now a vacation maximum grace period exception. So if you're at the max, you're not going to lose any hours for the next 4 months. There's also for people that have completely run out of all their leave, because maybe they're taking care of a COVID-19 family member. If you've used up all your leave and used up all the administrative leave, there's the Emergency Voluntary Catastrophic Leave Sharing Program, where people can donate to a bank and that can be drawn out of. And I did get asked to talk about the stimulus. So as you know, you've heard there's going to be money coming. Now it is tied to what your adjusted gross income is. So for instance, if you are single, your adjusted gross income, which is your income after deduction, so after you've taken the standard deduction, has to be under $75,000, equal to or under $75,000 to get the full $1,200 amount. And if you're a married filing jointly couple, that maximum is $150,000. So if you look at your the last tax return you filed, you can see what your adjusted gross income is and can fairly easily calculate what you would potentially get. Because once you go over the $75,000 for a single person, each additional $100, they will deduct $5 from that $1,200. And if you have filed in your 2019 or the tax year 2018, they will be using whatever is your most recent return to send that money directly to your bank account. If you have not filed in the last 2 years, you will have to file a simple tax return to be able to get it. And if your address has changed, is not currently on file with the IRS, there will be a portal that will be opened by the Treasury Department where you can register. And that's about it for what I've got. Back to you, Joe.
Thank you, Michael. There was an outstanding question from the last town hall, and that was how to donate blood. I think you may have noticed or read that the UCSF medical students organized an appointment-only blood drive on Parnassus, and it's taking place. It started yesterday, today, and tomorrow, and it will again April 7th through 9th. But as a reminder, you know, near Parnassus, remember we've got the Irwin Memorial Blood Center right there on Masonic Avenue. So for those that are interested, those opportunities and options are available. So at this time we've got, you know, about 7-8 minutes left. We're going to take questions from the audience, and Eric Davila will be reading them. Eric.
Actually, I'm going to take it today, Joe. This is Grant.
Oh, I'm sorry, Grant. I'm sorry. I knew that, Grant. Sorry.
First question, do you have more information on the testing capabilities at UCSF CZI?
The update on that changes by the day. The testing is a combination both from CZI, this is Joe DeRisi's operation, as well as the UCSF laboratory. Between the two, we have a capacity probably to do as many as 2,000 tests. At the moment, though, as they ramp up, they've only been able to get more in the neighborhood of a little over 1,000. And the reason they've only been able to go a little more than 1,000, because as some of you know, the shortage now are the Q-tips that are used, the long Q-tips that must go into the nose to do the actual culturing for the coronavirus. But they are ready to go, and they've got the resources and the technicians to be able to do it. So that is, so again, we would do a lot more if we could figure out the Q-tip issue, but people are moving on that as we speak.
Okay, next question. Current thoughts on NSAIDs in worsening COVID-19 disease. Are there any medications we should be aware of that exacerbate COVID-19 prognosis?
There was fake news on the use of non-steroidal anti-inflammatory drugs like ibuprofen. It started entirely fake, claiming that it hurt the immune system of patients infected with coronavirus. That is complete bunk. It's not real. And in fact, there is no data to say that non-steroidal anti-inflammatories cannot be used in patients infected with COVID-19.
Okay, and this question's been answered, but I just want to ask it in case anybody else also had the question. Please repeat the URL for the research website for QBI. And Joe, I don't know if you know that, but it's qbi.ucsf.edu/COVID-19. Next question, is the international postdoc also get financial assistance declared by the federal government? Yes, would an international postdoc get financial assistance?
Michael, take your best stab at that one, please.
I think unless you had filed an income tax report filing, I don't think you would be eligible for that. But I don't know for sure. We'll look into that and post an answer on the website.
Next question, can you comment on the steps being taken to plan for a potential shortage of drugs associated with the pandemic, ventilator use, treatment, as well as potential shortage of drugs coming from abroad to treat other chronic conditions?
So what the questioner is referring to, it's not just the COVID-19 related drugs, but the fact that so much of the creation of our drugs, particularly a lot of our generics, comes from overseas, some of which is China-based. Everybody is aware this is an issue, but no one really has a good sense whether we have appropriate supply chain organization to in fact ensure that we will get these. At least at the moment, other than the drugs I alluded to earlier, we have yet to really come into that shortage. But that's a very good question, and it's a risk that we've all been worried about worldwide, let alone the United States.
Here's another one. The Bay Area shelter in place is currently until May 3rd. If the projected peak day is April 28th, do you think the shelter in place will last? And will we be working remotely?
Well, I can't say for sure, but you keep in mind that the April 26th peak, that is a target that came from essentially University of Washington. I encourage all of you to look at it. It's a quite elaborate, interesting website out of UW that does every state in the union. What I would repeat though is I believe that Northern California's peak is going to be much earlier than April 26th. For those of you that heard George Rutherford talk at one of many of these COVID-19 discussions, he suggested, he thought in 7 to 10 days, we would have a very good idea if we had flattened the curve and therefore peaked. Now, don't quote me on that. You can quote George Rutherford on that. But I think everything that we see up to this point suggests that his guess is probably a correct one. So therefore, we'll wait and see. If in fact the peak is much earlier than April 26th, perhaps the shelter in place will be able to be eliminated on May 3rd. If on the other hand, it looks more like what University of Washington is suggesting, probably not.
Okay, and this is a comment, maybe you could further comment on this. Most donation centers for blood and plasma, including IVIG and album, come from college. Sorry, doing the best we can. Come from college students who, as we know, are no longer on college campuses. So many are worried that we'll have a shortage in the coming months as college students are at home.
A shortage. I'm not sure what they meant by a shortage. Shortage of blood? Is that what you're saying, I guess?
Yeah, I think it's a shortage of blood.
I don't know what to say. All I know is, I think there's been enormous encouragement and advertisement that all of us, including all of us on this call, consider donating. So I really can't comment.
Okay. The news came out that the Boston Medical Center has furloughed 700 employees. Do you expect to see this trend at medical centers across the country at UCSF?
I have no idea. Here's what I will say to everybody listening. The chancellor made it clear. Let's take a step back. You all know we're talking about the virus, but perhaps the biggest risk is going to be the economic downfall that already exists. And the assessment is probably we'll have 30% unemployment rates in the United States as a result of this. There's little doubt that every single industry will be impacted by that. And so in answer to the question, there has been absolutely nothing discussed as it relates to UCSF Health or UCSF, the campus side, or the individual schools on furloughing. I mentioned this before, for those of you that actually do your timesheets and turn them in, there is in the drop-down menu where it says vacation or sick or whatever, it has the word furlough. And people said, hey, where did that come from? And my answer to that is that word has been there for at least 10 years. So don't read into it. And so on one hand, I want everybody to realize it seems impossible that we will not be impacted by the economic downfall with the virus. On the other hand, I will tell you with complete honesty, there is not one discussion that has taken place regarding furlough at UCSF.
Okay, I know you were planning on leaving at 3:30. We got a couple more questions. I don't know how many more you want to take. I could kind of prioritize them for you.
Well, and I want to make sure I am respectful to others in the call. Maybe let's just do one more, and then we will do our best to answer the others via email if we know who the questioners are.
Okay, there's been a couple questions asking for the website for COVID updates, so maybe we could just provide that really quick, and then I'll ask this last one. You can get more information on the COVID response at UCSF at, I believe it's ucsf.edu/COVID-19. And the School of Pharmacy website also has updates. And then this last question, are pharmacy students going to be backtracked academically due to this?
So I don't know what backtracked academically means. If the question is, and I don't know which class we're talking about, we fully are planning on the class of 2020, graduating on time, even though we do not have a commencement ceremony at the moment. We are doing our best to get two classes, the two classes of 2021, to get them ready and rolling. As we already know, there's a delay of 6 weeks before we get those started. And we're going to just have to take it a day at a time. And then for those that are not in experiential, we are doing what every school of pharmacy and every school of medicine is doing in the United States, and that is doing the best we can to ensure the quality of the education is absolutely first cabin. I want to remind everybody, students don't go to school anyway anymore to listen to us lecture, and in some ways COVID-19 turned the corner for us and made us, in fact, change the way we do things. Hopefully, when we get back together, we'll start problem solving again in person. I really hope and pray that the education of our students is not impacted in any way. So I think I'm going to close by reminding you of a few things. There will be another town hall April 9th from 3 to 3:30. The Outlook invitation has already been sent, and there will be another one the week after that. I will say, I'll give you a hint. I told you the April 9th one, in addition to my usual updates, you'll be hearing, as I said, from Fran Owika regarding the clinical science taking place in the school. You also will be hearing from Lisa Kroon on a couple of new patient care initiatives that she will summarize for us as well. And the week after that, I will say, will be a special town hall. I'll lean intentionally and to make sure that you participate in that one the week after next. In the meantime, I just want to say to each and every one of you, and sometimes I have to look in the mirror and say this to myself: slow down, enjoy the now COVID-19 induced clear sky and water, appreciate your loved ones, take a nap, stay safe and well. Thanks for listening.